Assalamu alaikum everyone, welcome to Med Concepts. Today we will discuss the brachial plexus, one of the most important nerve networks of the upper limb. It is a favorite topic in anatomy and is commonly tested in exams because it explains many nerve injuries, including Erb's palsy and Klumpke's palsy. By the end of this lecture, you should understand its formation, parts, branches, and common clinical conditions. The brachial plexus is a network of nerves formed by the anterior ventral rami of spinal nerves C5, C6, C7, C8, and T1. Its main function is to provide motor and sensory innervation to almost the entire upper limb, including the shoulder, arm, forearm, and hand. Simply remember, brachial plexus equals C5 to T1 equals upper limb nerves, components. The brachial plexus is divided into 5 parts. 1. Roots. These are the anterior rami of C5 to T1. 2. Trunks. The roots join together to form 3 trunks. 3. Divisions. Each trunk divides into an anterior and a posterior division. 4. Cords. The divisions reorganize to form 3 cords. 5. Branches. Finally, the cords give rise to the terminal nerves. The sequence is easy to remember using the mnemonic. Ramu Kaka drinks cold bear, that is, roots, trunks, divisions, cords, and branches. Roots and trunks. Let's look at the first 2 parts. The roots are C5, C6, C7, C8, T1. These roots carry nerve fibers from the spinal cord. The roots combine to form 3 trunks. Upper trunk equals C5, C6. Middle trunk equals C7. Lower trunk equals C8, T1. These trunks continue toward the shoulder. Divisions and cords. Radial nerve, from posterior cord, supplies extensor muscles. Main action, extension of the elbow, wrist, and fingers. Median nerve, from lateral and median cords, supplies most forearm flexors and the thenar muscles. Important for thumb movements. Ulnar nerve, from medial cord, supplies most intrinsic muscles of the hand, responsible for fine finger movements. Remember the mnemonic RAMMU, radial, axillary, musculocutaneous, median, ulnar, Erb's palsy. Now let's discuss a common clinical condition. Erb's palsy occurs due to injury of the upper trunk, C5 to C6. Common causes include difficult childbirth, fall on the shoulder, trauma to the neck. The patient develops the classic waiter's tip posture. Features include arm hangs by the side, shoulder is internally rotated, elbow is extended, forearm is pronated. The patient cannot abduct the shoulder or flex the elbow properly. Klumpke's palsy. Klumpke's palsy occurs due to injury of the lower trunk C8 to T1. Common causes include pulling on the arm, falling while holding an object, birth injuries. Features include weak hand muscles, claw-hand deformity, difficulty gripping objects. Because the intrinsic muscles of the hand are affected, fine finger movements become difficult. Slide 9. Clinical importance. Why is the brachial plexus important? It helps doctors diagnose nerve injuries, identify the level of trauma, plan surgeries. Thank you. Any questions? Thank you for watching. If you found this lecture helpful, don't forget to like, share, and subscribe to Med Concepts. See you in next video.